Presenting the mechanisms of normal labour, I will be using this model pelvis to represent the maternal pelvis and this to be my fetus. After the first stage of labour is complete and the cervix has completely thinned and dilated to 10 centimetres, the second stage of labour will progress. During this stage, the fetus will enter the maternal pelvis. In this case, the fetus is in the ROA position or the right occipital anterior position. Once it has entered the pelvis, the head is in the largest diameter of the pelvis. This means that the sagittal suture is in the transverse position, allowing for it to pass through this larger section of the pelvis. Once the baby is inside the maternal pelvis, the fetal axis aligns, which is the head, the shoulders, and the fetal sacrum. With increased pressure of the uterine contractions, there will be increased pressure on the fetal sacrum. This allows for the fetus to be pushed further into the maternal pelvis and allows for flexion of the head. If the head is well flexed, the chin will be touching the chest of the fetus. This also allows for the suboccipital pragmatic diameter to present, which is the smallest diameter of the fetal head into the maternal pelvis and through the ischial spines. With additional contractions and progression of labour, the fetal head will push against the pelvic floor. This will continue with the flexed position until the pelvic floor is stretched. With this progress, the fetal head will rotate 1/8 anteriorly against the pelvic floor. This allows for the other diameter of the head to come through the maternal pelvis. Once this occurs, the head will go under the suprapubic arch and into the suboccipital region and extend. This is the crowning. Once this crowning has occurred and additional uterine contractions are in play, there will be a pushing of the fetus through the maternal pelvis and out of the vagina. This is the baby's head being born. Once the head is born, we can allow for restitution. Restitution is where the head tilts back, that 1/8 rotation it made earlier, and allows for the fetal shoulders to go through the maternal pelvis. This process means that the anterior shoulder is able to go under the suprapubic arch, and the posterior shoulder goes into the hollow of the sacrum or the curve of Caris. This allows for the shoulders to be free during the next contraction for the baby to be delivered. For the baby to be delivered, once the head is out, we do also need to apply lateral flexion. With the next contraction and for the body of the fetus to be born, we can continue to apply lateral flexion downwards towards the perineum or the anus. And with that contraction, we can allow for the anterior shoulder to slip under the suprapubic arch and out through the vagina. Then your baby is born.